Is your posture always a struggle because of hypermobility? If that's the case, let's explore what's going on and how to fix it. In this video, I'll be talking to you about some of the key factors for you to pay attention to when it comes to fixing your posture, how to breathe biologically or correctly, and what specific areas to pay attention to bring more awareness into your movement and posture. So let's begin. By the way, if you have not subscribed to my channel, make sure you do so because this channel is dedicated to you as an individual with hypermobility or EDS or any other connective tissue disorder leading to instability of your joints. When it comes to our posture, we have three diaphragms: vocal diaphragm, abdominal diaphragm, and pelvic diaphragm. These are to be parallel to each other and stack on top of each other. In a hypermobile individual, what I'm used to seeing is more than three. In other words, the areas of transition and extra movement or movements opposite of each other or curvature opposite of each other still reside within the one section. So while in a normal individual, there is only one section between vocal diaphragm and abdominal diaphragm, I have seen more than one unstable section somewhere in between there. The worst I've seen was up to 9 in the whole spine. So instead of 3, having 9 different sections there that were, I would consider, transitional areas. And the beauty of it is doing the same type of work that I am about to show you, and of course doing developmental exercises. This individual was able to not only manage their posture but actually go on and do exercises that they never dreamed about. So let's begin by paying attention to our biological breathing. Biological breathing is something that we do. I call it biological breathing myself, and I have a specific cueing for my bendy patients, so I call it bendy breathing. I'm going to make sure I put that video at the end of this video so you get to see it. That way, if you have not subscribed, hopefully you will now, and you get to see what that's all about. So when it comes to bendy breathing, and when you do that, you're essentially putting inner tubing inside of you by breathing correctly, which is inspired by watching human babies. So if I were to ask you to take a nice deep breath in and you go, you're actually creating movements in the mid-back, in the chest, and there is a lot of rocking of the pelvis. All of these are faults and issues that can lead to injuries and further instability. Instead, when you do biological breathing, there is no movement in the chest or the mid-back or the pelvis, so things are a lot more stable. So if every breath makes you unstable when you're doing wrong, then every breath done correctly will allow the stability to be there. So that first step in the right direction in stabilizing your joints and managing your posture properly is proper breathing. The next thing that we want to do is when I ask my patients, I have this principles of movement that I suggest, which is if you place your hands on the balls of your hip joint and imagine the bump at the outside of your ankle, and if you can't see it, maybe put like icy hot or something that's spicy over that area, something that you're not sensitive to, just to bring a different sensation into your brain so the eyes of your brain can see the bumps here. So what you want to do is you want to have the balls of your pelvis, of your hip joint, over the bump of your ankles, just like so. So if you're in front of it, or if you are behind it, which I don't see that as much, it's more of a this presentation, then you catch yourself. The next thing is you want to see your neck, and you can place your hand on your neck just to use that touch to bring more awareness so your brain sees it better. And believe it or not, you can place your hand in the perineum. Perineum is that part of your body that's behind your vagina or base of the penis and in front of the anus. So that way it gets to see it. And what you want to see is, does the neck line up with the perineum at the same time the balls of your hips lining with the bumps of your ankles? So that means if I am in this position, even though the ball may be over the bump, but my neck is not going to be over my crotch, over my perineum. So I need to fix that. And the fix is much more subtle than you realize. So if I'm tilted this way, I want to rotate the pelvis into a neutral spine. Neutral spine is as if you lay down on the floor and you close the gap in the small of your back. When you close that gap, you have to rotate your pelvis up to close the gap. So in this standing up position, the wall behind me is like the floor if I were to be laying down on the floor. So neutral spine is closing that gap, keeping the ball over the bumps and neck over my crotch. This is going to take time. You don't stand up practicing this for the first time. Connecting to your neutral spine is something you want to do on the floor with your knees bent. Just kind of let the brain see it. As you're doing this, you are breathing biologically. And the next thing you want to pay attention to is your xiphoid. So your xiphoid process is, if you follow your ribs, your rib cage up, it comes to the chest bone, and the other side comes to the chest bone. The tip of this chest bone is what xiphoid is. And when you are in a slouched position, which is most often the case, you are compressing this xiphoid onto your diaphragm. So think about the xiphoid process going straight up towards the ceiling, not towards the wall in front of you, because then that means you're going to be sticking your chest out. What you want to do is you want to engage this band of muscles to pull your rib cage up as the ball is over the bump, neck is over the perineum. So neutral spine, biological breathing, xiphoid up towards the ceiling. And now when you're standing up, pay close attention to your weight distribution over the bottom of your feet. Most often, my patients are too far in the midfoot or the forefoot area of their feet, hardly on the heels. So I want you to keep yourself not rigid, but nice and plumbed, and try to see your heels and you standing on your heels in your head. Can you stand on your heels? Can you put your weight over your heels without your toes coming up? These are all challenges that you have, and this is simply in a static standing up position. You don't go to this position skipping the preliminary steps. So the best thing to do is, once again, lay down on your back with your knees bent, practice biological breathing as you close the small of your back. Make sure you follow me on my social media. Here, I do a lot of videos that I share with you, because my goal is for you to be able to manage your hypermobility yourself. If you do need help understanding how to be and how to begin and what to do first and what to do second, and of course, I'm here for you. The goal that I have is to transfer my knowledge to you so you go for the rest of your life managing your movement properly. Managing your hypermobility is all you can do. We can't make the hypermobility go away, but you can certainly manage it much better. And management starts with movement. And of course, injuries happen with movement. So the whole concept of kinesiophobia, fear of movement is a true thing, and it doesn't have to be if you understand what you're looking at and what needs to be in place. I know there's a lot of things that are easier said than done, but understand that going forward is its incremental progress, meaning each day get better and the previous day, and don't look at am I there yet, look at am I closer or not. Thank you for watching. Thank you for subscribing. And until next time, take care.